Smith. I'm the Executive Director here at Bridge Community Health Clinic. We are very honored to welcome Governor Evers, his team, our partners from the Pharmacy Society of Wisconsin, and many of our local pharmacists, and members of the media. Thank you for joining us. In life, people often cite three big fears. One is public speaking, which I can attest to today, serious illness or death, and then waiting in line at the pharmacy wondering what their prescriptions are going to cost. Now, that's actually not really on the top 15 list, but it does roll into fear of medical debt. So it's an important component. As a federally qualified health clinic, we do understand the unique challenges, financial challenges that our patients face. And accessing a healthcare provider does not ensure access to all of the parts of a patient's treatment plan. Specialists, ancillary care, medical supplies, and very important life-saving medications. That is why, along with the Wisconsin Primary Healthcare Association, our clinic supported passage of the Pharmacy Benefit Manager Regulation, Senate Bill 3. Affordable medications are an essential part of access for primary care, behavioral health, and dental services. Our clinic and many others like us already use tools such as sliding fee discounts, 340B drug pricing programs, and patient assistance programs to help patients defray costs. But passage of bills such as this ensures that our patients will benefit from increased transparency and accountability. The bill's gag clause prohibition is especially meaningful for our patients. We believe that all consumers have a right to know how to access the medications they need at the lowest cost. This bill is a great step forward in mitigating that fear at the pharmacy counter. We are grateful to Governor Evers, the legislature, and the Pharmacy Society of Wisconsin for taking this important step that will benefit our patients. Now I would like to welcome our partner, Kristen Weiler-Knights. She is the owner of Snipeman Pharmacy in Neillsville, Wisconsin, and a member of the Pharmacy Society of Wisconsin.
Good morning. My name is Kristen Weiler-Knights, and I am a pharmacist and owner of Snipeman Pharmacy in Neillsville. I want to thank Governor Evers, as well as the bipartisan group of legislators that introduced this vital legislation, for supporting legislation that will increase transparency and accountability for pharmacy benefit managers. Thank you. Every day, Wisconsin pharmacists dispense nearly 200,000 prescriptions and are all too often confronted with the reality that some of our patients suffer a significant financial burden when paying for their medications. As a pharmacist, my goal is to improve the lives of my patients through quality medication use. Unfortunately, I often see patients who struggle to afford necessary medications, and countless others that I may never hear from choose to go without their necessary and life-saving prescriptions due to concerns about cost. Proper use of prescription medications is critical in achieving positive health outcomes for patients. When medications are not taken appropriately, it can lead to adverse health outcomes, emergency room visits, inflated healthcare system costs, and even death. This new law will make a real, meaningful impact on my pharmacy and patients by addressing the practices of some PBMs that impede access to life-saving medications and burdens the resources of my staff as they sort through these issues for patients. Pharmacists are healthcare providers whose ultimate goal is to ensure patients utilize their medications to provide the most success. I applaud Governor Evers and the bipartisan group of legislators who introduced this bill for prioritizing legislation that will lower drug costs, increase access to care, and create a more transparent and accountable system. Thank you.
Thank you. Thank you, Jennifer, for inviting us back to Bridges. It's my second visit as governor in just a little over 2 years, and it's just, to me, it's an institution that has great, gives people great hope, and in the Wausau area. So I thank you for your great work, and also just to put it in context of the vaccinations that are going on here today also. It is really important for me as governor and frankly all the people of the state of Wisconsin to make sure that anybody that is eligible to get a shot, has that opportunity. And sometimes people are more hesitant than others. And Bridge Community Center does just a great job of catching people who may have otherwise fallen through the cracks. And that's actually true also when it comes to the importance of getting a vaccine. So this institution here in the Wausau area, the Bridge Community Health Clinic, has done a great job and will continue to do a great job even after the vaccination period is over, because there are a lot of people that need a lot of help, and this is an institution that provides it. So I'm really glad to be back. They provide services from behavioral health to mental health and obviously primary care situations, and it's just a real honor for me to be here. The other thing that Bridge does as it relates to the entire state is around vaccines, and I just want to let people know here in Wausau that we're making great strides in that area. Yesterday was the highest number of vaccinations we've ever had in the state of Wisconsin. We had 78,000 in one day. Right now we're at the level of 2.4 million people in the state of Wisconsin have received the vaccine, and almost 900,000 of them, including yours truly, have had both doses. So we're moving forward in a good way. We're looking forward to a day where this pandemic is at least moderated to the point where people can do the things that they want to do to live their lives more freely than they have in the past. But in the meantime, I'm encouraging people to make sure that they're still wearing masks and still keeping socially distant. There is still virus in the state of Wisconsin, and frankly, in the county surrounding us, or the state surrounding us, there is an increasing number of people who are becoming infected. So it's still an issue. But that said, this is a really important piece of legislation, but it is part of a number of things that we propose in our budget. One of them is to expand Badger Care for the people in the state of Wisconsin. Very simply, it will save us money. It will provide over $1.6 billion, that's with a B, and to the state of Wisconsin, and it also draws down over $3 billion, that's with a B, for helping, making sure that we are working all across the state to make sure that people that have disproportionately poor health outcomes actually increase their ability to access affordable and accessible health care. So we're also in the budget, we also have an additional $4 million for folks that are federally federally qualified healthcare centers, which is not as much as they need. Obviously, there's great need. But in addition, if we had Medicaid expansion, I think we could do even better. So there are also, in the state of Wisconsin, there are people that can't afford prescription drugs. They're cutting their pills in half. They're putting off taking the doses that they should be taking on a regular basis. And our budget tackles that also. And it was such popularity that it actually got taken care of early by a bipartisan group of legislators, which is great. It is around the issue of making sure that we control costs and have a transparent system with our pharmaceuticals in the state of Wisconsin. So this morning I'm really excited to be signing SB 3. SB 3 creates licensing requirements for pharmacy benefit managers. And I wish I would have brought along the diagram that shows how drug costs, pharmaceutical costs happen in the state of Wisconsin. It is a very complex supply chain, but one of the key people in that supply chain are the pharmacy benefit managers. And this bill requires them to register, has more accountability for the work that they do, and also, frankly, it will save money and put more power in the hands of the pharmacists in the state of Wisconsin. as mentioned earlier, it also will not allow gag contracts with our pharmacists, in that pharmacists, after this bill is signed, will be able to tell their customers exactly what benefit, what cost-cutting measures have, and which drug company or which drug they should be buying at a lower cost that will save money. So it frees them up to be the professionals that they are. And so I'm very happy to sign this bill, and let's make that happen. So this is Senate Bill 3. It passed on just a few days ago, and in the Senate it was a 31-1 vote, and in the Assembly 94-0. So this is bipartisan legislation I'm really happy to sign. And 326, 2021, and this becomes Wisconsin Act 9. Signature. Voila. Gives our pharmacists a chance to be the great professionals that they are, and puts them more in charge of the patient's use and the purchase of pharmaceuticals in the state. Thank you all. Thank you. Thank you. Thank you. Thank you. Okay, we just made a great step forward in the state of Wisconsin, and for the consumers of and the people that work very hard to make sure that they stay healthy, and the people that help them stay healthy. With that, any of us would be glad to answer any questions you might have.
Governor Evers, Drew Sutherland, News Channel 7. I was curious, with the rise in COVID cases in the past few days, are you going to extend the mask mandate?
Well, we're still looking at that, and obviously we're getting very close, but we are waiting for the kind of the final observation as far as the number of cases in the state. It seems to have plateaued. We certainly would rather have it be decreasing rapidly. We have the states that are surrounding us are having increases, and if indeed we need to do that, we'll be doing that in the next couple of days. But we're waiting for some final numbers to see if there is a downward trend. It really is. We don't have any end that we say it has to be at this level. It needs to be continuing downward. And frankly, that is what's happening right now. It seems to be plateauing. So if need be, we will be issuing that order in the near future.
Governor Evers, Channel 9, Chase McNamara. I'm curious, is there any other bills that you are hopeful that will get bipartisan support that can be signed quicker as we wait for your budget proposal to go?
Well, I signed probably another 20 or 30 just today, smaller items that meet some particular small needs across the state. That's why we're not talking with them today. But yes, well, the budget is the biggest bill, and over time it's become the major policy lever that the state of Wisconsin has. And so I'm hopeful that we will get some common ground with that budget. I think it's a budget that's eminently affordable. We have the resources to do it. I mentioned just briefly in my comments about Medicaid expansion, and people of Wisconsin have talked about that for years, and federal government has created even more incentives. I frankly, other than the speaker, I don't know who else in the state of Wisconsin is against Medicaid expansion. So hopefully we can convince him of the wisdom of that. I know the budget has some significant money for small businesses that in order for them to recover from this pandemic, and I believe we'll have great support with that. In addition, I think the Democrats and the Republicans both understand how important broadband is. in healthcare for sure, but also as it relates to telehealth and other services. But the broadband is something that inhibits, if you don't have it, inhibits small businesses in rural Wisconsin to conduct their business. So I think there are some really important areas that there will be common ground. Unfortunately, we all kind of play this game of huffing and puffing during the budget time and calling each other names, but at the end of the day, there will be some good support for a lot of the things I talked about, especially in healthcare. I just hope that we are not the last state standing that doesn't take Medicaid expansion. That would be not only make us look foolish as a state, but it won't allow us to bring the resources our healthcare providers need in order to serve the people of the state.
Governor Evers, Liz Holbrook, WSAU News. So you're obviously going to be pretty busy here in the next few days as you have a lot of bills coming your way. The legislature has been very active. But some interesting comments from the Assembly Speaker earlier this week about how, depending on which way you choose to use your veto pen, he may potentially bring a lawsuit to the court. What are your kind of comments to that and maybe that suggestion of the legislature taking that action?
Well, again, we're in the huffing and puffing time. And so I take that with a grain of salt. Kind of threatening legal action doesn't necessarily solve any problems, but this legislature has been active in that world, and especially as it relates to various requirements that I think we could have saved more lives during the pandemic. And so I don't discount anything or make light of lawsuits. I'll continue to do the right thing for the people of Wisconsin, and those threats notwithstanding. I just find it to be not particularly helpful, but that's the way politics work from time to time.
Today there's a Stop Asian Hate event that you will be participating in. We have quite a large AAPI community here in this area. What is your message to the folks that may have experienced bigotry here and to all Wisconsinites who may have experienced that?
It is. The AAPI community is no less a Wisconsinite than anybody else, and we have to treat us all with dignity. That's why I love these community clinics such as Bridge, because everybody is welcome, everybody gets great service. We work together. I was mentioning before, I was in Blackbird Falls just yesterday actually, with the Ho-Chunk Nation, and they have done a really great job of putting shots in the arms of their members. Yesterday they opened it up to the community, and without any reservations, and they anticipated that and I was there, they anticipated 1,000 people from the Black River Falls area who were going to be served by the Ho-Chunk community. It's always about neighbors, helping out neighbors, and we do need to move beyond the rhetoric, the racist rhetoric that happens, and the hurt that happens when, as a state, we don't recognize that all folks that live in the state of Wisconsin are friends and neighbors, and we're just working hard to do the best we can. Outright attacks on that community, whether they're verbal or physical or others, just cannot be tolerated. They are our friends and neighbors, and we must have a system of mutual respect.
Wisconsin is among one of the top states in terms of vaccine distribution, but we weren't at the beginning. What changed?
That's a great question, and first of all, we're getting more vaccine. That has helped, and I attribute that a lot to the new administration and their single focus on that. But the other thing is that we have a great number of vaccinators. I'll give my staff all sorts of credit. The work they do is 24/7 as it is with vaccinators. But we have over 2,000 vaccinators in the state of Wisconsin, and approaching 3,000, I believe. And that is really high as compared to other states. And they're all quality, and they range. And the important thing is they range from the healthcare providers, the big ones in the state, the Auroras and the others, to small clinics like this and our tribal nation. So we just have just a really solid group of people that, vaccinators that are just doing a great job. And it takes time to get that cadence down to, as far as, making people, how are you gonna get people to the clinic? And are you gonna take reservations? Are you gonna let it be walk-ins? And all that stuff takes a little time, but, and the demand is real high. And so I think right at this point in time, we're doing well, and we have a good percentage of people every single day that increases. I do have concern going forward, we will reach a point where we have a group of hesitant people, and we will need to get them, as many as them possible, to be vaccinated. And that's what one of my first comments was about a bridge, and their bridge to the community, especially folks that haven't been part of the healthcare world. And we can have the wonky bucks do advertisements on TV. We can take pictures of the governor and the first lady getting a shot, the Packers, you name it. But it's these local folks, these local validators that are going to be the ones that really get us over the hump once we get through this massive group of people we're working on now, because we need everybody to be vaccinated, and it's going to take everybody, especially at the local level, especially friends. I give you a small example. In my extended family, we have an individual that is less than hesitant. They're in opposition of vaccines, and it has taken at least 40 hours of conversation with my wife and this extended member of our family to say, okay, I'll get the shot, will you come with me? And it's going to take that. It's going to take that. And so that's why I'm so pleased to be here, because this is an organization that has that ability and that trust to get people shots.
We have time for one more question.
Do you have an open dialogue with President Biden, and have you spoken to him in general, just to make sure that we have a steady supply that continues?
Yeah, I had a chance. President Biden came to Milwaukee to do a town hall meeting, and I had a chance to be with him after that, and we talked a lot about vaccines. In fact, there's vaccines and grandkids, I think, and we talked about vaccines first. And he's single-minded on this issue, and he always has, as have I. We have to make sure that people understand this pandemic is not a hoax; it's a real thing. We have people dying. We still have people dying. So we have to do the right things. And clearly, one of the biggest mitigating things that we can do is vaccinate people, as many as possible. And he is doing everything in his power, and there was no reluctance on his part, making commitments to our state, but also other states, to get as many shots in people's arms as possible. And he works with the companies to make sure that happens. So thanks, everybody.